Now, the Minister of State for Health, Social Welfare, Dr. Isiaq Salako, has revealed that plans have been finalized to establish and upgrade 6 federal teaching hospitals. Dr. Salako says this will be done with new radiotherapy and nuclear medicine facilities across the country, with 3 centers set to be commissioned in May 2025 and the rest before the 2026 World Cancer Day.
To raise awareness about cancer prevention, detection and treatment, with a global push to reduce the impact of the disease. To beat cancer, these experts here say it will take combined efforts through raising awareness and improving prevention techniques through vaccination, early detection, prompt treatment and research.
While the vaccination for the viral hepatitis has been on the National Program on Immunization, HPV vaccination was commenced in 2023, and it is heartwarming to know that we have successfully immunized over 12 million girls for human papillomavirus, and effort is ongoing to improve on the successes recorded so far.
We should not focus just on treating the disease, but we should adopt perspective and experience of individuals, carers, families, and communities.
One of the major areas of disease management, including cancer care, is in the area of nuclear medicine services, which Nigeria lacks. But to change the tide, the ministry is now inaugurating a 35-member nuclear medicine technical working group to spearhead the management of cancers and other diseases.
That while our experiences and challenges may differ, our goal remains the same: ensuring equitable access to cancer prevention, early diagnosis, treatment, and care for all Nigerians.
As a country, we developed a very robust initiative, including partnering with the International Atomic Energy Agency, to develop nuclear medicine program in Nigeria. The National Nuclear Medicine Management Committee that was set up by the ministry in 2010 did their best and facilitated training of several nuclear medicine physicians and other allied health care professionals.
The Minister of State, as well as other experts here, agree that although the present administration has made substantial investment in cancer prevention and care within the last 18 months, a lot
more in August 2016. So I started checking after examinations. I was told in March 2017 that the tumor is cancerous, and that was how the journey started. And it has not been an easy journey. Yes, I have done 8 sessions of chemotherapy. I have done 25 sessions of radiotherapy. I've been on hormonal therapy. Now I am on targeted therapy. So it just keeps going and going and going. And like the theme of the World Cancer Day this year, United by Unique, every cancer patient has their own journey. You know, there's nobody that has, no 2 persons has the same story. No 2 persons has, they might have similar outcomes, but different stories. So for me, I just tell people I've been fighting for the past 8 years. I mean, literally fighting for the past 8 years. But I'm grateful to God that I'm still here. And you asked how I survived.
Yeah.
Yes. Besides trying to do what the doctor asked me to do, being very vocal has helped me a lot. Talking about my challenges has helped me. And I started doing that because I identified a gap in the system where patients do not talk. There was so much silence and stigma, and people just want to hide away from their reality. And it was not helping other patients coming behind, because people were likely to know someone that died from cancer than someone that has survived cancer. So where did they build the grit to fight if they are diagnosed? Yes. So because I didn't see anyone to talk to, for the first 2 years, I made mistakes, and I made up my mind I was going to be vocal about my journey. I was going to talk to people. and I was going to make sure they have a face to identify with survivorship that is actually black and Nigerian. Because when the doctor said to me, "Oh, madam, this thing in your breast looks like cancer, and if it's cancer, we'll chop off your breast." That was the way he said it to me. What came to my mind was the white women I had watched in movies diagnosed with cancer. And the usual line is, "Oh, I'm dying." And they're like, "Oh, do you have cancer?" I say, "Yes." And then the next thing, the person is pale, the hair is gone, and then the person dies. I've not seen anyone survive cancer in movies. And I didn't know people that have survived physically when I was diagnosed. So I made up my mind to be vocal and put my story and my picture out there to encourage other people. And that is a form of healing for me as well. Because when people say to me, "I saw your story online, it encouraged me. My sister saw your picture online, it encouraged her." It feels like I'm doing something good with such a horrible disease. And that is happiness for me. And I ask for help. The worst I can get is a no. Nobody's going to beat me for saying, "Help me." So I ask for help, emotional support, psychological support, financial support. Anytime I need help, I tell people what I need. And honestly, I have the best support system in the world. Yes, they may not have all the money to give me all the times, but they are always available.
Okay,
and,
so
these are some of the ways I've been surviving.
Interesting. It's just very touching.